Sean Middleholtz began coughing up blood 3 years ago. He was given medication for pneumonia. It happened again when he was visiting his grandparents in Moose Jaw, only that time he couldn't breathe. He was rushed back to Regina and put in a medically induced coma. Doctors couldn't figure out what was wrong with him until one doctor came across a single paragraph that seemed to match his symptoms.
My condition is hughes-stovin syndrome. Basically, it's a rare form of Behçet's disease. However, it's more general problems with the circulatory system. In my case, I have a blood clot in my superior vena cava and multiple aneurysms in my pulmonary arteries.
Behçet's has been described as a rare disorder that causes blood vessel inflammation in the body. Sean's condition affects his lungs and his heart. He says surgeons were able to treat some of the aneurysms on his lungs so they didn't fatally burst. But as far as the Middleholtz family knows, there is no satisfactory cure for what Sean has. His doctors say there are only a handful of cases around the entire globe. Sean's dad says the worst part of this is not knowing where it came from or how to help.
When your child is small, you can take care of a cut or a bump or a bruise and everything, and you're the hero. You made it all better for them. You can't do that with this.
Sean was feeling better for a little while and his family thought things were looking up, but he was recently diagnosed with pulmonary hypertension. Now he's waiting to hear if he qualifies for surgery in Ottawa. His dad is both hopeful and nervous.
From what I gather is they go in and they try to remove the clot. So you can imagine what that's going to be like. But if it keeps him with me, then he's my only boy.
Sean's family has started an online fundraiser to cover his anticipated travel expenses. If he doesn't go to Ottawa, he likely will have to go to Saskatchewan for treatment. There, they hope they can try and figure out how to maintain his condition. Kendall Latimer, CBC News, Regina.